Hi, I am Dr. Indranil, a practicing consultant diabetologist. I'm back again with an important and interesting connection or revelation in between COVID-19 pandemic and diabetes. As you all know, patients with diabetes have been in the spotlight since the early stages of the pandemic as growing epidemiological evidences and data have revealed that they are at higher risk of severe clinical outcomes from the pandemic. In light of these findings, several diabetes federations around the world have issued statements and provided resources to help patients with diabetes to better understand the risk of COVID 19 and how to more efficiently manage their condition. In May 2020, with the understanding that the evidence base was still a moving target, but that guidance for clinicians was urgently needed. An international panel of experts in the field of diabetes and endocrinology published in the Lancet Diabetes and Endocrinology the practical recommendations for the management of diabetes during the pandemic. However, epidemiological data and guidance on COVID 19 and diabetes have focused almost exclusively on type 2 diabetes mellitus. In the Lancet Diabetes and Endocrinology, research was published assessing the absolute and relative risks of COVID 19 related mortality by type of diabetes in more than 61 lakh individuals in England. After adjusting for key confounders such as age, sex, ethnicity, index of multiple deprivation, and geographical region, the odds for in hospital death with COVID 19 were 3.51, that is 95% confidence interval was ranging in between 3.16 to 3.90 for people with type 1 diabetes and 2.03, that is ranging in between 1.97 to 2.09 for people with type 2 diabetes compared with people without diabetes. Understanding which risk factors might have a role in increased severity of COVID-19 pandemic in patients with diabetes is a priority for clinical practice and public health. A companion paper published in the same issue used a national dataset linked to national civil death registrations covering 98% of general practices in England to investigate the associations between various risk factors and COVID 19 related mortality in people with both types of diabetes. The authors confirmed the independent associations of several risk factors such as age, sex, ethnicity, and socio-economic deprivation with COVID 19 related health or death. Importantly, the study also shows that the risk of COVID 19 related mortality is significantly and independently related to hyperglycemia in people with either types of diabetes. Hyperglycemia can impair host defenses, and poor glycemic control have been associated with infections. Given that glycemic control is a modifiable factor and can be achieved and sustained by healthcare interventions, these results emphasize the importance of supporting people with diabetes in effective self-management. As the global COVID-19 pandemic continues to evolve, it has also become clear that the interplay between COVID-19 and diabetes entails a complex pathophysiology. Not only are COVID 19 outcomes more severe in people with diabetes and metabolic dysfunction, but recent data also suggests that COVID 19 could precipitate acute metabolic complications of diabetes, such as diabetic ketoacidosis and hyperglycemia. The mechanisms underlying these links remain unclear but likely to involve the angiotensin converting enzyme 2, that is ACE2 receptor, a binding site for the severe acute respiratory syndrome coronavirus 2, that is SARS-CoV-2, which is expressed in key metabolic organs such as the pancreas and in the beta cells in particular. Potentially, the SARS-CoV-2 tropism for beta cells could lead to cell damage and an impairment in insulin secretion, triggering hyperglycemia and ketoacidosis. It has also been postulated that SARS-CoV-2 exposure can precipitate type 1 diabetes onset. Data collected between March and June 2020 from 5 pediatric inpatient units from 4 National Health Service trusts in London, UK indicate an increase in the number of new type 1 diabetes cases in children compared with a typical year, although causality cannot be established at this stage. Important information is likely to emerge from much larger and comprehensive data sets. To this end, in June 2020, an international group of diabetes experts announced the launch of COVID-Diab, a global registry of COVID-19 related diabetes. This registry aims to investigate the extent and pathogenesis of new onset diabetes and metabolic dysfunction in pre-existing patients with diabetes to help uncover novel mechanisms of disease and define the best interventions. Thank you.